Now to a new health conversation. This morning, our Kyrian Lee sits down with Dr. Roopa Shah to talk about a mild form of pneumonia called walking pneumonia. Here now is that conversation.
Dr. Shah, thank you so much for joining us.
Thanks for having me.
Absolutely. Yeah. So first, who can get walking pneumonia and how does it spread?
Yeah, so anyone really can get walking pneumonia, but we do tend to see this in school-age children, adolescents, and younger folks more often. But it is spread by respiratory droplets, so very common this season. Spread just like the common cold. Somebody coughs or sneezes, somebody else inhales those droplets, and then they can get ill from that.
Okay, so very easy.
Very easy, unfortunately.
So when should you see a doctor?
Yeah, so walking pneumonia basically is very similar to an upper respiratory infection. You can have some fevers, chills, cough, congestion, fatigue, but the hallmark really is that that cough is going to linger. So for weeks to months later, people are still coughing. You're still feeling unwell, fatigued, maybe even having some low-grade fevers. That's the time when you should seek medical attention because clearly it's not clearing up and there could be turning into a walking pneumonia.
And if you don't get it cleared up soon enough, what are some of the risks of not, going to see a physician?
Yeah, so if you don't see somebody, it's going to probably just continue to linger. Your symptoms, you're going to start feeling worse. You can develop shortness of breath, wheezing, other signs of distress. This is more commonly seen in younger children. So there will be some signs and symptoms that will alert you, especially as a parent, to know this is when I need to take my child in. Again, if you're seeing them wheezing, struggling to breathe, or just working harder to get their air, then it's really time to get into the doctor and consider getting a chest x-ray or other laboratory testing.
And I know we've talked about this in our past segments, but what are just a few things that people can do to keep themselves, well this season?
Yeah, so this will, again, it's always tough in the winter because we're always in close quarters with people. But again, good hand washing, right? That's always key. Masking if you're feeling ill, keeping the children home if they're sick, and getting your vaccines, right? Getting those immunizations for flu and COVID, RSV, all those other vaccinations that keep us safe during the winter time to avoid all these different viruses that are out there.
Very good. Well, Dr. Shah, thank you so much for joining us.
Yeah, thanks for having me.